My name is Zach Seeloff. I'm a pediatric nurse in the operating room at UW Hospital's American Family Children's Hospital. And joined by all the amazing nurses behind me and all the amazing nurses in the hospital today, I want to tell you that for my nurse colleagues, for my family, and most importantly for our patients, I am going on strike.
In the emergency department, we've not only had the same staffing concerns that the rest of the hospital has faced, that stem from honestly staffing being cut. Consultants were brought in, told our hospital how we could be more efficient, and the answer was to make nurses do more with less, and all staff at the hospital do more with less. So in the emergency department, they've cut down the float nurses that basically are there to jump in a pinch in the emergency department. You never know what's coming in the door until it's there, essentially. So we had extra staff in the department that were there to jump in, help cover things when you had multiple patients who were very ill, when you had a trauma patient come in that needed a lot of resources, just kind of fill in the gaps anywhere there were, and also provide essential things like a lunch break in a 12-hour shift. Those nurses were the first things that they cut. They also cut the amount of staff in general throughout the hospital. So at the same time, we then had issues getting patients into inpatient rooms because they're either the hospital has been at capacity or those floors don't have the nurses to safely take care of patients. Even when they're being pushed to take care of more patients than safe, they still don't have enough patients or enough nurses, enough staff to cover all the patients that we're trying to admit. So then not only are we short-staffed, but the emergency department starts boarding nurses, meaning that people are spending hours and sometimes overnight in the hospital. And sometimes people who are admitted to the hospital then get discharged from the emergency department without ever seeing their inpatient room because we never found anywhere to put them. So you can imagine then those patients, instead of being in the room for just a few hours before they go upstairs to their bed, they then stay there overnight. And then we have more patients coming in the door the whole time and nowhere to put anybody. And we've had more patients in the hallways. We've had more patients, our overall patient volume and census has been higher. As our staffing in the emergency department especially increases throughout the day and decreases at night, but then all night long, when you've got the fewest amount of nurses at 3 in the morning, you've got 14 extra patients there, or 25 extra patients there who don't have a room upstairs and are taking up beds. So as you can imagine, the challenges have been pretty intense already. And then on top of that, because of these conditions, because we have nurses with a wealth of experience who don't feel safe taking care of these patients anymore, we've then had lots of staff leaving. And this is really just sort of emblematic of what's happening throughout the hospital. At the same time, I work with a great team, and we're all very proud to work at UW Hospital, and we do everything absolute best that we can to take care of our patients. So we're in every patient room trying to give everybody a happy face, make sure that our patients don't know exactly how stressed and how stretched we are. It's the life of being a nurse, but lately it's been stretched to the breaking point, and we've seen quite a bit of burnout. We've seen a lot of good experienced nurses leaving, like I said, and then we've been trying to fill those gaps, and it's just contributing to this overall cycle of just worsening staffing and worsening morale and worsening burnout amongst our staff, as well as folks then also working overtime trying to pick up and fill the gaps and help out their team. To be quite frank, you then have nurses both in our department and upstairs in the inpatient floors who have too many patients. Our staffing levels then are unacceptable. We have more sick patients than we should have. We have patients, and we don't have any safe staffing ratios because there's nothing mandated in our hospital, and that also leads to unsafe situations and outcomes. There's a national nursing crisis right now, nursing staffing crisis. And at UW Hospital, 2 years ago, we didn't face this. We were doing fine because we were a place people wanted to come work. We were a place people were proud to work. Now we're a place that people are burnt out, they're worn out, and they're stretched doing the absolute best they can to take care of patients.
And I just wanted to kind of say too, as we're losing, really truly experienced nurses who know that there's better places that will value them, the administration has been filling those with new nurses, which is not necessarily the answer. So we're seeing this lack of experience filling some of those gaps, which is great. But for those of us who are experienced, it puts even more burnout in precepting all these new nurses and training all of them. And the weeks and months that goes into nurses is a lot. So to put them into an environment where they don't feel supported is a whole other issue. And I think that, you know, as we talk about staffing a lot, know that those things are trying to be worked on, I suppose, but none of it is really with nursing input and feedback or involvement in some of those decision makings. So that's one of our biggest things as well. My biggest task tonight is to talk a little bit about what the hospital system is saying we have as a voice, and that is shared governance and our council structure. They believe that that replaces the need for any sort of union because we can have our voices heard in this council structure. How it works is we have nurses join councils. There's about 8 core councils, and then the chair and co-chair meet every month. It's usually about a group of 20 nurses, so the leaders of each of those councils meet with nursing leadership and administration every month. What I found in my 5 years in one of the really top councils that works right alongside our nursing leadership is that our voices don't go anywhere. Change does not happen. We expressed very sincere concerns about nurses' safety, of our license, patient safety. We hear about the things that should not be happening in a hospital, things that aren't safe. We come up with ideas, we brainstorm ways we can help, but we reach, you know, ears that aren't listening. And administration is saying that they didn't know things were this bad. But I will let you know, our CEO has never attended a nurse council meeting until just yesterday. So I think that goes to show the fact they didn't know this was happening is just untrue. And I think what we're really finding right now is a lot of their excuses to not listen to nurses' voice and our concerns and our genuine fear for our patients and concerns that, you know, we can't be quieted anymore, and that's why we're here tonight.
Barely recognize us. After the board meeting, we called all 16 board members to ask them to meet with us. 6 have, and 2 more have agreed to. We are far from having the members on the board that we need to talk to at this time, and that's why we're here. We asked to speak at the last public board meeting almost a week ago. By the way, they're always the 4th Thursday of the month at 1:30 p.m. And we had 10 minutes on their agenda. We were excited to have the opportunity to address them, and a little surprised that they didn't ask more questions with us. We learned why they didn't when before the meeting had even ended, they had sent out a press release patting us on the head, so to speak, and telling us that Act 10 prevents them from recognizing us. Their hands are tied, says Dr. Kaplan. Here's the thing, they're flat out wrong. It's not that they can't recognize the union, it's that they don't want to. Like hospital administrators everywhere. Rather than come out and say that, they're counting on us to give up. We have yesterday's article in the Wisconsin Examiner if people want more information on the legality here that's being passed out right now, and that explains a little bit more in depth what we're asking for, including meet and confer. We didn't start this effort to give up, and as patient advocates, we don't feel that we can. We are called to stand up for you and for your care. I'm going to ask Mike.
On Labor Day, it's important to remember unions are not a thing of the past. Unions are how we have won hard victories to make life better for workers everywhere. They are just as relevant today as they were 100 years ago, 150 years ago, and that is why we are here today to form a union of nurses. Workers across the country are rising up. We know teachers in West Virginia and Oklahoma. We know other nurses in Minnesota and California. Municipal workers in this state here and so many others are going on strike and demanding their union rights, and we are here to do the same. UW nurses are not alone in this fight. We are joined by so many other union workers who are here to support us, so many elected officials who are here to support us, and members of the general public who know how important the work is that we do and how important it is that we have a seat at the table so we can advocate for our patients. So, with all that said, It's time to get on to the people who are here to talk about this union effort, what we can do to help, and how we can make it successful. I would like to introduce, to begin with, Representative Francesca Hall.
And as a mom, a service industry worker, and a small business owner, I am proud to be pro-care work, pro-care worker, pro-union, and pro-union for nurses. UW Health nurses have been a part of my entire life, from mental health care to reproductive health care. They were probably one of the first people to hold my son after he was born. It's the UW Health nurses who are trusted adults in my son's life, and one of the first people really to enter his life and make a difference. Right now, we are in an era that demands movements and resistance. We must center dignity, respect, and care for working people to benefit the lives of all. It is past time to take a stand for labor rights, not only because our conscience demands it, but because the future of Wisconsin relies on it. As policymakers and legislators, our commitment to the working class cannot end at some boilerplate support for rolling back Act 10. We must also find new ways to build coalitions, bring everyone along in this movement by reaching out to voters, educating the public, and making strong and principled arguments for labor and labor protections. We need a cultural reset, to be honest, here in Wisconsin. We need to make sure that none of our nurses or our working class have to make the hard decision between their health and their job. They should not have to check their rights at the working door. The well-being of our workers is the well-being of our children, our state, and our democracy. Today marks a renewal for the fight for what's right, and again, I am honored to be here with all of you. Thank you.
I've worked at UW for 19 years, and 15 of those years has been as a nurse. I am proud of what I do, and for most of my career, I have been proud of where I work. I remember the days when we had a union contract and when our hospital put people before profits. But things have changed since that contract expired in 2014. I remember the moment when I couldn't bear those changes any longer. Administration decided to disband our SOS nurse team. For those who may not know, our SOS nurses are our rescue nurses who swoop in when a patient is having a code blue or is rapidly declining. They literally help save lives in the hospital. This was a huge loss, and it was scary. I was so frustrated that I sat down and I wrote out 40 things, a list of everything that we had lost since our union disappeared. They were changes like cuts to staffing ratios and benefits. One of the changes was cuts to nurse training hours. We used to allow nurse residents time to take on patients slowly as they became more comfortable. New nurses would start with one patient and then maybe a week later move up to caring for 2. They had time to learn, and there were enough nurses to train new folks. Now our new nurses are thrown in with a full load, and if they need help, odds are they have no one to turn to other than another new nurse, because so many experienced nurses have left UW. This is not right. It's not right for new nurses. It's not right for experienced nurses. Most importantly, it is not right for our patients. As nurses, we don't like to be vulnerable. We want to be strong for our patients and for one another. We are highly trained, skilled professionals, and we have been reduced to begging for help. That is no way to run a hospital. That's no way to run a healthcare system. I have a message for the hospital administration and the board. Shame on you. Shame on you for allowing it to get to this point. Shame on you for dumping money into buildings instead of patient care. Shame on you for turning business of caring for people into just a business of profits. And to the UW board, we have reached out to you over and over and over, and every time you turn us away, all we want to do is talk, and you won't even give us that dignity. To CEO Alan Kaplan, as a doctor, you should know about quality care, but you haven't taken care of your staff, and that means you aren't taking care of your patients. I've worked at UW through the tenure of 4 CEOs. I will never, ever stop fighting for my union, and I will never stop fighting for my colleagues. I am not okay with average care. and I don't want to be in the 50th percentile compared to other hospitals. I want the best patient outcomes, not average ones. How do we do that? Together. I want UW to be a leader again. Our patients deserve it, and if I have to walk off the job to demand better for them, I'll do it. We're willing to do what it takes because that's what our patients deserve. Recognize our union now.
My name is Jack Trudell. I've been a nurse for 28 years. I've worked at UW Hospital for the last 18. I've worked in critical care, I've worked in procedures, and I presently actually work out at the newly christened East Madison Hospital in the recovery room over there. Newly rechristened, I guess, because in the time of crisis that we're in, Dr. Kaplan and the board decided to spend tens of thousands of dollars to change the name of a building. I was also a nurse during Act 10, and I was there on that terrible day in 2014 when we lost our union. And I can tell you that, things weren't perfect, but we had language on staffing ratios. We had a grievance procedure. We could actually redress it. So if somebody stood up and said, this isn't safe, or I don't feel safe doing this, they got to respond. They had to respond to that. If you didn't, we brought the full force of our grievance procedure down and our union contract down. And I will say, as a nurse with my experience, and I think every nurse can say the same, I've been really scared at work, but I knew what to do in those situations. And I will tell you, the scariest feeling I've ever had was when I had to walk back into the hospital in 2014 without that union protection.
Well, it is great to be with everyone here on Labor Day, and what a perfect day to say thank you to all the amazing nurses at UW Health. Let's thank those nurses. For the last 2.5 years, our nursing personnel at UW Health and other facilities have taken care of us during what I think is probably the most challenging 2.5 years most of us have had in our lifetime with COVID-19. And it is so appreciated, the work that they've done. I come here as one of the chairs of the Labor Caucus in Congress and as a 3-decade-long member of the International Union of Painters and Allied Trades. My brothers and sisters in the union appreciate that. Thank you. I can tell you from this experience, there's no question that when workers have a voice in their workplace, you will have better outcomes no matter what the job is. And in this case, there's nothing more important than someone who works day to day with people in hospitals and clinics, who knows what's best for those patients and their care, to have a say in their workplace, in their working conditions, in the safety conditions, and in their pay and their benefits. And that's why it's so important that the UW Health Board listen to this message very clearly today. You have a world-class organization, a world-class institution in the UW Hospital. And you have that because you have world-class employees and nurses at UW Health. You now need to put on your big boy and big girl pants and decide to make a world-class decision. Respect your workers and recognize this union. There doesn't have to be a strike. The board can simply follow the advice of Attorney General Josh Kaul and recognize this union and do the right thing. But if they don't, I think everybody around us and hundreds times the number of people here will support every single healthcare professional and nurse at UW Health when they do have to strike, because the best interest of this community is to have the best healthcare workers with the best working conditions at the best facility, and they can make that decision. UW Health Board, recognize this union.
We have been fighting for our union for 3 years. Our patients need us to fight for them because this administration will not. We are here because we want quality patient care, we want respect, and we want recognition of our union. This strike is about taking care of patients, but we aren't given the tools to do that job. Administration has cut staffing, taken away proper training. We are exhausted, making us prone to mistakes. Patients deserve better. I am encouraged by all the love and support we have gotten from our community, our fellow unions, elected officials, and the governor. We've heard solidarity messages from across the country and from patients here in Madison whose lives we've touched. But at work, it's a whole completely different story. We are not treated with respect. We are being intimidated and harassed, especially in these past few weeks. We need the administration to stop hiding behind Act 10. The Attorney General has given you the green light to recognize our union. There is nothing that prevents UW Health from recognizing us except themselves. We have been fighting this fight for 3 years. It's time for them to come to the table with us. Nurses are not good at asking for help, but that's what I'm asking for, and we shouldn't have to ask for help. To the community, come out, show up, we need your support. Please come to our rally at 4:30 on the first day of our strike, September 13th, at the First Unitarian Society, 900 University Bay Drive. If you can't come to the rally, please join us on the picket line, even if it's just for a little bit amount of time. We will be out of work from 7 a.m. on September 13th to 7 a.m. on September 16th. We will be there fighting for patients and for ourselves and for the entire community. Solidarity forever.